This is critical thinking in special senses, and here are the questions. So here's a clinical question to do with smell, and here you have to identify the false statement, and here is another clinical question. So let's look at this first one, where it tells you that from years of sniffing formalin, Adam found that he had lost his sense of smell. So which area do you think was primarily affected? So let's look at the choices. And the first one says temporal lobe. Now this is not a choice because even though the sense of smell is perceived in the temporal lobe, if you look at what the question says, it says from years of sniffing formalin, he has lost its sense of smell. So by sniffing formalin, the formalin fumes would not go straight up to his brain and affect his temporal lobe. The sense of smell will be lost if there's some problem, some neurological damage to this temporal lobe, either because of a vascular lesion or something else. So sniffing will not go immediately to the temporal lobe. And that same thing holds true for the olfactory bulb also. So even though the olfactory bulb is concerned with smell, this is not the first site that is going to be affected in this situation. The third choice, which is the limbic system, the limbic system is also associated with smell. But here again, sniffing, where the fumes go in, they will first go into the nose and damage something in the nasal cavity rather than going all the way up to the brain and damage structures in the brain. So hence this is not a choice. And the last statement, which says the roof of the nasal cavity and the adjacent part of the nasal septum. So if you look at the nasal cavity, and this is the septum, and you're looking at it from the front. So this is one nasal cavity, and this is the other one. So this is the floor. This part is the floor of the nasal cavity. This is the roof, and this area in the center is the septum. The olfactory epithelium lies along the roof of the nasal cavity and the adjacent part of the nasal septum. So this is where the olfactory epithelium, which has the bipolar olfactory cells, this is from where the impulses of smell will go up and they'll go to the olfactory bulb, be carried by those bundles of olfactory nerves, pass through the cribriform plate, go through to the olfactory bulb and then to the temporal lobe. But when you sniff, this is the part that is going to be damaged first, which is in the nasal cavity. So hence, this is the correct answer to this question. And this also tells you where the olfactory epithelium is located. Let's look at the next question, which is here, which is asking you to identify the false statement. So the first one says that the olfactory nerves, when damaged by nasal infections, are capable of regeneration. So similar to the first question, if damaged by nasal infections or any other condition, like when you have prolonged sniffing of pungent fumes, these nerves are damaged. And as you know, there's not a single olfactory nerve, there are 20 bundles of nerves. Now, the peculiar feature of these nerves is that these nerves themselves, the bipolar neurons themselves, act as receptors, and these are one type of nerves which are capable of regeneration. In fact, they're replaced every 2 months or so. So this is a true statement. Let's look at the next one. It says only one cranial nerve is involved in the transmission of taste impulses. Now this is false, because if you look at the tongue, and here we are looking at the tongue, this is the anterior end of the tongue and this is the posterior part, and over here we have there's a sulcus which divides it into an anterior 2/3, and then we have this posterior 1/3, and this is where the circumvallate papillae are present, and then this area here is the posterior most part of the tongue. So from the anterior 2/3, the 7th cranial nerve carries taste impulses. From the posterior 1/3, it's the 9th cranial nerve. And from the posterior most part, it's the 10th cranial nerve. So we have 3 nerves which are involved in the transmission of taste impulses, not one. So therefore, this is the false statement. But let's look at the other questions. Here it says raised intraocular pressure causes the eyeball to become hard. And this is true. Raised intraocular pressure, as is seen in glaucoma. Glaucoma, which is either due to increased production of aqueous humor or decreased reabsorption or drainage of aqueous humor. Suppose there's a blockage in the canal or Schlemm, the intraocular pressure can be raised, and yes, it does cause the eyeball to become hard. So this is a true statement. And let's look at the last statement, which says the cochlear nerve carries impulses from the organ of corti to the auditory cortex of both temporal lobes. So this is also true. The cochlear nerve is responsible for carrying the impulses of hearing, and that is through the organ of corti, which is the sense organ. And it does go to the auditory cortex, which is where in the temporal lobe, but it goes to both auditory cortices. So therefore this is also a true statement, and the only statement which is false is the second one, and hence the answer to this question. Let's now look at the third question, which tells you that 6-year-old Stephen caught a cold, and this soon spread to his middle ear. Through which one of the structures below was the infection likely to have spread? And let's look at the choices. And this is a common occurrence in children where they catch a cold and it does spread through the middle ear. So the first one is oval window. Now this is wrong because the oval window connects the middle ear with the internal ear. So if I was to draw a rough picture and say this is the auricle, this is the external auditory canal, and this part here is narrowed where it's known as the isthmus, where the bone meets cartilage, this part here. Then you have the tympanic membrane here. So this is the tympanic membrane. This is the middle ear. So this is the external ear and external auditory canal. So I'm just going to put it here. So this is the middle ear. And then here is the internal ear where you have the semicircular canals and the cochlea and so on. So this is the internal ear. Now this middle ear connects to the internal ear by means of a little window here, which is called oval window. So this is through the person had a cold, which means it affected the nasal cavity. So you have spread of infection from the nasal cavity to the middle ear. So it couldn't pass from the oval window because the oval window connects the middle ear to the internal ear. You need something to connect it from the nasal cavity, or actually not from the nasal cavity. It goes to a place known as the nasopharynx, and from there it goes to the middle ear. So it's not the first one. The second choice is the tympanic membrane. It's not this one either because a tympanic membrane is a plate, a membrane which is present between the external auditory canal and the middle ear. So this is not going to cause spread of infection from the nasopharynx into the middle ear because, this connects these two structures. The third choice, which is external auditory canal, again for the same reason, is not going to be how the infection passed, because has to pass this way. This external auditory canal is on the other side of the tympanic membrane, so this is not going to spread the infection. The fourth choice is ossicles of middle ear, which again, this is not true. The ossicles are the malleus, incus, and stapes, because these are the ossicles which are present here. So the infection is, again, as I said, in the nasal cavity and then goes into the nasopharynx. So you need something to connect it from the nasopharynx to the middle ear. So these ossicles are not doing that. They are present in the cavity itself. So this is not a choice. And let's look at the last choice, which says Eustachian tube, or this is also known as auditory tube, or the best name for it, which helps you to remember it, is known as the pharyngo tympanic tube. Pharyngo for the pharynx, tympanic for tympanum, which is the middle ear. Another name for the middle ear cavity is tympanum. So tympanum is another name for the middle ear cavity. And we said pharyngotympanic, that means from the pharynx to the tympanum. So if you look at that image that I had drawn, so here was the ear, the external auditory canal, tympanic membrane, this is the middle ear cavity, and then if you remember, I drew something like this, and then this is the internal ear where you have the cochlea and the semicircular canals. this here is the Eustachian tube or pharyngotympanic tube, which connects the pharynx to the middle ear. So when someone has an infection in the nose, it travels into the pharynx. From the pharynx, it goes through the pharyngotympanic tube to the middle ear cavity and hence causes infection in the middle ear cavity. So the answer to this question is the Eustachian tube.